Hi, Ma'am Gacera, and hello, classmates. My name is ToniRoseTanaleon, and I'm a student and at the same time working in the government hospital as midwife 1 in the pediatric ward. And the medical instrument that I chose for our task is about syringe. I have here a 10 cc syringe without needle, but I just removed the needle. It has a needle. There are syringe which has a needle that can be used for injecting or withdrawing chemicals or fluids or medicines, injecting medicines in our patients. This syringe has a plunger, barrel which has measurements, and a needle. It also has the rubber stopper. And aside from injecting fluids or chemicals, you could also use the air or by just, for example, if I'm going to remove the needle, you could um, you could insert air inside this syringe. You just have to pull the plunger and the air goes into the syringe. And if you're going to push the plunger, then the air inside goes out of the syringe. So we used to inject air when checking the patency of the nasogastric tube before feeding the patients. And later I'm going to show a video about it. Now I'm going to check the patency of the NGT by using a stethoscope and a septo syringe. I'm going to inject the air and listen to the sound. If I could hear a rumbling or bubbling sound, then it means that it's patent. So now I could be able to feed the patient. If the patency fails, then you have to inform the physician or doctor so that they could reinsert the NGT correctly. We could also, aside from feeding, we could also give oral medicines using this syringe. You just have to dissolve the medicine using dissolve the medicine in the water and then just allow it to flow down using the gravitational force. It will just go down by itself. Now this food is a mixture of fluid, water, vegetables, and rice, milk, or cereal. It was prepared in the dietary department by a dietitian or nutritionist. Now, in order to speed up the process, since if you're going to wait for the fluid to flow by itself, it would take time. So I have to use the bulb. Press the bulb. And pressing the bulb, the air inside will cause pressure for the fluid to uh, flow down the tube faster. So I'm using force in this video to speed up the feeding process. Next is I'm going to use a device. It's called a syringe pump device, syringe driver. I already inserted a 20 cc of breast milk inside the syringe and entered the 20 numbers in the machine. As you can see, there's a number there, shows 20, the green one. And then if you will press the green button, it will start to work.
Okay.
So it will slowly feed the patient. The babies, mostly the preterm babies or infants, are using this kind of machine. So the importance of physics, as you can see, physics is everywhere in our daily activities, and all the technologies we use are developed and governed by the laws of physics. In the medical industry, it develops medical equipment to prevent, diagnose, treat, and rehabilitate illnesses and diseases in a safe and effective way. Thank you so much for listening.